Venowave is a compact battery-operated peristaltic pump that generates a wave-like motion in the lower leg. This produces a volumetric displacement of blood and tissue fluids, which translates into an upward increase in venous flow. The Venowave VW5 increases peak venous flow in the popliteal and common femoral veins, as measured by duplex ultrasound. The Venowave is an FDA, CE, and Health Canada approved ISO-compliant Class II medical device. It weighs in at only 250 grams and runs on a single AA nickel metal hydride rechargeable battery. The Venowave enables an active lifestyle for the patient and improves their quality of life. The Venowave VW5 indications of use are management of the symptoms of Post Thrombotic Syndrome, PTS, treatment of leg swelling due to vascular insufficiency, treatment of varicose veins, treatment of chronic venous insufficiency, and treatment of intermittent claudication.
My training here in McMaster was after medical school. I completed internal medicine and then 2 years in thrombosis with the clinical team here, which is world-renowned. And then I went off to Boston and spent a year doing a clinical fellowship in vascular medicine. We certainly have a large number of patients who suffer deep vein thrombosis, and the downstream side effects of deep vein thrombosis after that has been treated is chronic leg swelling or post-Phlebitic Syndrome. So those patients are often in need of therapy, and the best we can offer them at this point is to wear compression stockings to decrease the swelling. There aren't very many, if not any, medications that are effective in improving walking distance in PAD patients. Sometimes having surgery or an angioplasty stent procedure will improve walking time. So we are evaluating the Venowave as one potential way to improve the walking distance of patients with intermittent claudication. Well, I think a big advantage of the Venowave is it is a portable device and it's battery operated. So individuals can carry on with their usual activities without having to sit down or be plugged into a wall or hooked up to a machine. So I think that's a huge advantage of the Venowave. And certainly it works to decrease swelling in post-Phlebitic syndrome. It works to prevent DVT, and now we'll see if it improves walking distance.
I was trained as a hematologist 35 years ago. I differentiated entirely into the field of thrombosis. I came to McMaster in end of 1969, early 70, to establish a thrombosis program. The Venowave has the potential to help anyone whose symptoms are caused by sluggish blood flow in the veins of the leg. A colleague of mine, Jeff Ginsberg, said, well, sure, it'll work in venous thrombosis, but there's a much greater clinical need in treating what's called the Post Thrombotic Syndrome. And what the Post Thrombotic Syndrome is it's a complication that occurs in about 20 to 40% of people with large venous thrombi, that's clots in their legs. And it occurs because the clots damage the venous valves. And as a result, when the person is standing, there's an increase in venous pressure down in the calf and the ankle. And the patient then develops swelling of the leg, an aching leg, sometimes severe pain, discoloration. Peripheral arterial disease is common. It's caused by hardening of the arteries that supply blood to the leg and the foot, atherosclerosis of the peripheral leg arteries. And patients develop what's called intermittent claudication. That is, they develop cramping of the calf when they walk a certain distance, which is relieved when they stop. and then they can start walking again. And typically, the patient can walk almost the same distance each time. We did a pilot study in 2 patients who had pretty severe intermittent claudication. We decided to do a controlled treadmill study, and that's being done in Dr. and Ann's clinic. Because it's battery operated and because it's light, it's able to be worn outside, and for people with post thrombotic syndrome, it's worn all the time. You know, when I say all the time, they can wear it for as long as they like.
The Venowave is an effective drug-free therapeutic solution. It can be used in hospital and at home. It offers greater effect than compression stockings alone, has good patient compliance unlike pneumatic compression devices, and is cost-effective.